Yes, you are welcome back from that break and still Frontline on New Frontiers Television. Yes, this morning we want to talk about a particular sector, one of the important sectors in Nigeria, in the country. You know, not in Nigeria alone, but in a particular country, and that is the health sector. Yes, you recall that in Nigeria, the National Association of Resident Doctors, that is NAT, they've embarked on strike, and today makes it day 26 that they've started the strike, you know, due to some of the demands that are not met by the federal government. And this morning we have Dr. Saul Adeleke, a senior resident clinical pharmacology, to talk about, you know, this industrial action. What exactly are these demands? And there have been reports, you know, over weeks that, you know, the federal government is trying to negotiate with, you know, NAD, and of course they are not backing down. They said their demands must be met. So I want to talk about this morning. You're welcome on the show, sir.
Thank you very much. Good morning, our audience.
Yes. Now, looking at this industrial action, yes, some Nigerians know that, you know, the essence, you know, of this strike is because the welfare of the doctors are not catered for. Of course, they are humans. They are taking care of human beings. So it's expected that, you know, they are also taken care of because they are frontline workers. We know some of these demands, but as a senior doctor, what are the main demands that NAD actually wants the federal government to actually look into?
Okay, thank you very much, Ma. Thank you for bringing this up at a time like this. Today is day 26 of this conundrum, of this avoidable trouble, avoidable evil. And it's not a thing of pleasure for me, for any doctor, to talk about this. The reason is simple. Thousands of people have been affected by this. If you will pardon me, sometime last week, I think it should be last week Tuesday, I was on a call with a colleague when someone else called, and I had to give my other phone to my wife that picked the call, and my wife said, "Oh, my dear, this is an emergency." So I had to drop the call with my colleague. The call basically was about someone diagnosed with something, if not managed immediately, could lead to death in a matter of 24, 48 hours. And they refer them from one place to the other place, from that place to UCH. What can they do? And I just asked them, let them show up in UCH. I will see them. I will assess the assessment, and I will see what can be done. Of course, I looked at the patient, 25-year-old lady, fresh graduate, awaiting NYC call up, and we just had to put her on antibiotics, rush her to a private hospital, get someone to operate on her, and today the lady is fine. What if they did not know where to go? What if they did not know someone to call, and the person they called did not know someone to call? Today, that lady is alive. How about hundreds or thousands of other people who are dead? Now, this is the issue. We are on strike, not because we want to go on strike, not because we are tired of seeing patients. The truth of the matter is that I still consult people on my phone. Yesterday, I had to do 2 consultations free of charge. I'm not charging them. And I know a great number of my colleagues do that. Because we don't want anybody dead. It could be your relative. It could be my relative. It could be anybody. Now, this is the real thing. There is a severe shortage of staff in all our hospitals. I'm not talking of doctors only. I'm talking of all core healthcare workers. Doctors, nurses, lab scientists, physiotherapists, pharmacists. Mention anything. And why do we have the shortage? Let me shock you. In a department in the foremost teaching hospital in this country, there was a time that anytime they advertised to take resident doctors, they would take nothing less than 20. I remember when I was to go to clinical pharmacology department, when I did my own exam, there were 20 of us that came for the exam. And they were going to take 2 or 3 people. But 20 people applied and wrote the exam. 18 of us did the board interview. This year, there was an advert. We did not get a single person to apply. Last year, we did not get a single person to apply to that department. 2 years ago, we got only 1 person to apply. 3 years ago, we got only 1 person to apply. So it continued to dwindle. 3 years ago, 1 person. 2 years ago, 1 person. Last year, none. This year, none. I remember when I started residency at Lautech Teaching Hospital, our own batch of doctors coming into internal medicine, we were 11. Today, Lautech Teaching Hospital, Department of Internal Medicine, Lautech Teaching Hospital, does not have a single registrar. But my own batch there, we were 11 that came in. And of course, there were people that were there ahead of us. There were people that came in after us. But today, not a single registrar. They have 3 senior registrars. What is the problem? The remuneration is a major problem. Because it pays me today to leave residency and work in a private hospital. What I will earn as a private doctor is much more than what I will earn as a doctor working with the government. That is a basic truth. And it's not just doctors, it's the same thing with nurses. Are you aware that in the foremost teaching hospital in this country, and not just this country, the whole of West Africa, that nurses were employed, and after 2, 3, 4 months, they felt like this does not make sense. They resigned and went back to private because the salary in the private sector is much more than what you have in the public sector. And when you now look at the salary issue on one side, you now look at the shortage of staff because the job still has to be done. We are not getting good salary, one, and nobody wants to come. But the patients still want to come. So what 20 doctors would do 10, 15 years ago, you have to get 2, 3, 4 doctors to do it now. Maybe you remember the story of a resident doctor that died in Port Harcourt, overworked, but there was no other person to do the job, and the job must be done. After being tired for a long time, went to rest a bit, and then it was no more. Here was a doctor that had done everything and was about to jump to the UK. And let me shock you. Doctors, nurses, every one of us in Nigeria wants to jump to the United Kingdom. But even the health sector in the UK is having its own crisis. Why? They are clamoring for increments in their wages. They said over the last 10, 15, 20 years, inflation has eaten up their salary, between 20 and 37% of their salary. So let the government increase the salary so that the salary will be what it was some 15, 20 years ago. We want to run there because we consider it heaven on earth, in quotes. But the people there are fighting hard that, no, this system is not working. And yet, we want to run there because that place to here is heaven compared with air. It is well.
Yeah, you know, where you just landed, one thing just came to mind is that, yes, this particular issue is not peculiar to Nigeria alone. It's not. But it's just that one is actually better off. Now, looking at some of the news that it has been in spotlights about yesterday, the federal government said that they will approve or has approved 11.995 billion naira to settle arrears in 72 hours. Now the question is, the federal government, they are, especially this particular government, they are not the one that, acquired, okay, they acquired all these, areas, all these demands that are unmet,
Okay.
the money that they plan to, disburse, if eventually they disburse this money, will the resident doctors still, consider? Because as our last week, resident doctors were saying that no, this 19 demands must be met.
Okay. Thank you very much, Ma. A few things that I will say in response to that. Number one, government is a continuum. So there's nothing like this is Tinubu's government, that was Buhari's government, that was Jonathan's government. Government is a continuum. ASU is in and out of strike because of an agreement of about 20 years ago. So government is a continuum. So this government cannot absolve itself of the good and bad they inherited from the previous government. That is one. Number two, the major bunch of the crisis we have today came from the last administration. The last administration came from APC. The current administration is still APC. So the current government cannot absolve itself at all, at all, at all. That is two. Number three, in fact, most of the challenges that we are talking about started with the current administration. Not all, but a good chop of it is from this administration. And I give a few instances. There was the calculation of salary dating back to the days of the last few months of Buhari. And then this government came on board. Some things were discontinued and all manners of things. There was a warning strike I think about 2 or 3 months prior to this strike. And the government promised that, don't worry, go back to work. Within the next few days, we will sort it out. And it was never sorted out. Until 3 days before the strike started, when they started paying. Let me shock you. Some of the money that was paid 2-3 days before November were the balance of our salary of August, September, October, December 2023. So who was in government in the latter part of 2023? So they paid the arrears of the salary of the latter part of 2023. There were many other monetary issues. They promised that they will do it within 72 hours. Well, let them do it. If they do it today, tomorrow, within the next few hours, we will call a meeting. What do you want us to do? Is this sufficient? Yes, let's go back to work. It's not sufficient. Let's continue the strike. But then, the monetary issue is a different thing altogether. What about other issues? The collective bargain agreement dating back to several years, to 2008 or was it 2009? The agreement was that, every now and then we will review this wage structure, this, that. Were they done? Were they done under Jonathan? Yes and no. Were they done under Buhari? No. Have they been done under President Tinubu? Not yet. So these are the issues. Then, how about the doctors that were suspended at Federal Teaching Hospital in Lokoja because they agitated that we want better stuff in our hospital? They went on strike, and a few of them were handpicked that, you are a troublemaker, you are a troublemaker, this, that. They sacked them. We don't have enough doctors, and we still have the effrontery to sack some of the doctors that are trying to do the job of many others. Do you think that it makes sense? It's part of the demands of NAD. Record these people. Whatever you want to do it, but make sure you record them. The government has promised to look into it, but how many hours or days or weeks does it take to look into it? They promised to look into it before this strike started. Today is the 26th. So, for how long should we wait before they end up looking into it? These are the challenges.
Wow, it's actually a lot. It's really a lot.
Yes,
now, Yes, the demands have not been met, although you said that some areas of 2023 have been paid. But what if these demands are not met, maybe in the next 1 week, 2 weeks, even till the end of the year? So what impact do you foresee on the healthcare system, if the strike continues, if it carries like this?
Well, a few ways to look at it. If the demands are not met, I do not see NAD calling off this strike or suspending it. So the government will just have to do their best. Are we insisting that everything must be done right now? No. If we insist that everything must be sorted out now, we are being unrealistic, we are being wicked to ourselves, to our relatives. That's the truth. But if they meet a major bunch of it, oh my, do you think I'm happy? Not going to work? What I don't get to do in the clinic, I get to do it on my phone. My phone will just ring now. Hello, Dr. So, this, that. And like one of the people that I had to attend to yesterday is a member of my own church. Someone, in fact, okay, the first person I attended to is the son of a member of staff in UCH.
Oh.
And they had to call someone who now referred to me, and I asked them to come to meet me in a place. Okay, what's the complaint? These are the things that we can do. The other person was brought by someone that I know. And what could I do? Nothing emergency. So I had to tell them, okay, when we suspend this strike, you have to come to UCH. The third person was the one I attended to on the phone. I'm not happy. Be on strike. And I tell you, most of us are not happy, be on strike. Let the government do what is needful. Once they do it, we'll be glad to go back to work. But at the same time, we don't want to die. Imagine 2 people having to do the job of 4, 5, 6 people. You only know when you resume to work as a doctor.
Yeah.
You resume it in the morning. Normally, you should close by 4, 5. Sometimes you are still busy at work till 5, 6, 7, 8. And it is not that you are on call. Now, this issue of call that I just mentioned, there is a number of calls you must do in a month. When you have 6 people sharing the calls, then it becomes lighter. But when you are the only one or 2 of you that has to do the calls, that means you are technically working 15 to 18 days in a month, full day work, 24 times 15 to 18 days every month. These are the issues. We are dying in silence, but we don't want to die. We don't want to bury ourselves again.
Yeah.
It's pathetic.
It's really pathetic. Every time you just have to explain is something that it's actually worrisome. And of course, we feel your pain that, yes, you people are frontline workers. You are actually caring for people. So you need to be cared for as well. Now, at a time like this, when doctors are on strike, because I know that, what was it, last year, and I think early this year, the federal government issued the no work, no pay policy. Now, how are resident doctors, how are they being supported at a time like this? The financial support and also the mental support as well.
Okay. For the mental support, we have been bastardized so much that we have lost part of our sanity, more or less. So whatever the government does now, I don't think it can worsen the level of sanity. Everybody is just trying to see whatever it can do to cope. That's for the mental part of it. You just have to ensure that you remain sane or as sane as possible. For monetary aspect of it, we don't know what the federal government will do with November salary. They've not paid the salary yet because the month is not yet ended. Whether they will pay the salary or not, we don't know. But we know they have always threatened no work, no pay. It's okay. They did it with ASU. They've done it to resident doctors. And that's one thing that I should even commend this government for. Under Jonathan, there was a time we went on strike. I think that was 2014 or 2015. And the next thing is that all resident doctors in Nigeria sacked. And we said, okay, you sack us. Good news, we are jobless. We don't have any work. But after everything was sorted out, they had to recall all of us. Under Buhari, they said they sacked all resident doctors in the country and they will not pay us. They did not pay us for 2 months. When the strike was called off and we returned, they did not pay for those 2 months until a long time later. Whether this government will do it or not, I don't know. But this government has done something that makes good sense. They have not come out to say that they have sacked resident doctors. Anyway, how many of us are left in the country? We used to be about 20,000. Now we are talking of maybe about 9,000 resident doctors. So if they want to sack all of us, we'll be happy to be sacked. And we'll be happy to be recalled back to work. If they choose to pay our salary, good news. If they choose not to pay the salary, no problem. But like some of us have joked with, no work, no pay. No pay, no work. But unfortunately, it's the citizenry that will suffer this thing. It's unfortunate. How about patients that have terminal illnesses? Cancer patients. How about patients whose lives are dependent on dialysis? That they must have 2 sessions of dialysis in a week. They have to go to private hospitals to be dialyzed, and that will cost them much more. The truth of the matter is that the government is killing its own people. Just like we have insecurity in some parts of the country, the government is fomenting its own level of insecurity on the citizenry by putting doctors. And it's not only doctors that are on strike now. JSU is also on strike. That's almost everybody in the hospital setting is on strike. How come that we don't get to a state that soldiers, police do not go on strike? They are frontline security workers. Healthcare workers are frontline security workers. It's just that we don't carry guns. We carry syringes.
You know, just a question from where you just stopped now. We know that the major language that the federal government or the state government, understands is strike. But it seems as if oftentimes this strike is no longer working like that. Of course, it will later work when they realize that it's taking a longer period of time. So are there other ways by which you've tried, to speak with the federal government to ensure that, they meet up with these demands?
Yes, ma. Before this strike started, there was a notice that, resident doctors will go on strike by 20-something of October. In fact, there was supposed to be a strike that would have coincided with the Independence Day. But out of patriotism, Nigeria is our fatherland. All right, no, we should not go on strike around the time of independence celebration. They kept on pushing, appealing, telling people who know those people in authority, can you do this thing for us? Can you help us play with people in government? Can you do that? Nothing. And there was a countdown. 30 days to total, indefinite, comprehensive strike. 29 days to total comprehensive strike. 28 days, and NAD did 30 days of such. Then after that, they appealed to the government. Please, we should have started this comprehensive strike today. We are appealing to you. We don't want to go on strike. Please sort this thing out. We are giving you another 1 week. And then they started the countdown. 7 days to strike. 6 days to strike. 5 days. 4 days. 3 days, 48 hours, 24 hours. What did we get? And then the strike started on November 1, and everybody started jumping up and down. So why is it that we did not see the jumping up and down
before?
For more than a month?
Wow, this is...
It's lamentable.
It is. It's very lamentable.
It could be your relative. It could be my relative that is at the receiving end.
Yeah.
I don't know how many people have died.
Yes.
And I don't want people to die.
Seriously.
This is the job that we wanted to do. This is what we trained for. We don't want anybody to die.
You actually took an oath to, to save lives. But
yes. But at the same time, self-preservation is important.
Now, lastly, before I let you go on the show this morning,
yes, ma'am.
What is your message, for the people, the patients, and of course the general public at a time where, doctors are on strike, and of course it is day 26?
Well, it's not only doctors that are on strike.
Yeah.
It's almost everybody in the health center now. What is my message for our people out there? I've said this thing a good number of places. I heard it from a pastor when I was a student. He said there are 5 people that you need in your life. You need a priest over your life, someone that is praying for you. You need a lawyer, so that the day you enter into trouble, there is someone that can come to bail you out. You need a doctor. The day you fall sick and you cannot get to the hospital, you know someone to call that can come to your rescue. You need a stockbroker. I can't remember the 5th one now. My advice to everybody, please have people in your circle of influence that you can reach out to in cases of emergency. I remember a brother in my church, one of his children just started vomiting, and they had to bring the care late in the night. The good news is that we had a number of things that we could use to help the care at night, and the good news is that the girl survived it. Let everybody have someone you can call, so that when trouble comes, we pray that trouble does not come. But you can't live in Nigeria and say trouble will not come one day. Trouble will come, and it's not restricted to Nigeria. It's not about Martin Nigeria. It's a global thing. You have someone that you can call that, oh, Dr. Adeleke, I have this emergency. What can I do? So once you have someone you can call, the person can tell you what you should do in the meantime, can now arrange the best way to take care of you in the meantime. Because if you go to any of our public hospitals, especially where resident doctors do the bulk of the work, I'm sorry, there's nothing you can get done now. So please do everything possible to take care of yourself. Get the phone contact of someone that you know you can reach out to if there's trouble at any time. Please stay alive. I beg you, by the mercies of God, stay alive. Like there is this thing in what's it called in Hebrew. Pardon me, I don't know how to pronounce it. It says Gamze Yahavo. These two shall pass. This strike will pass. The evil in our society will pass. But it is the people who are alive at the end of the day that will see the end of the trouble. So please stay alive. Know the person you can call. Don't patronize wrong places. Get the contact of someone. And I tell you, it's not everybody that is looking for money. If I'm looking for money, I would have jackpot. I would have gone to the UK, I would have gone to the US or Canada, Australia, New Zealand, or even Saudi. I would have gone elsewhere. I've done more than enough consultation on phone or outside of the hospital setting in the course of these 26 days of strike without collecting a dime.
Thank you very much, Dr. Saul Adeleke. Thank you, for the enlightenment. And of course, we know that we are talking about the doctor strike and the inaction. Of course, you've heard it all. And like Dr. Saul said, please, in your circle, in your space, have someone that you can call, especially in the health sector, in case of emergency, and that person will be able to attend to you, and try as much as possible to live healthy. Eat healthy as well, because when you do so, you won't have to visit the hospital. And that's much we'll be taking on our interview segments for today. Once again, thank you very much, Dr. So.
Let's take a break,
and after which Frontline will continue with sport updates. Do stay with us.